Hi everyone, welcome to my channel, PsyDesign. My name is John, and I'm a PsyD student in clinical psychology. This channel is focused on helping students, trainees, and early clinicians understand how psychology actually works in real clinical practice. This is the very first episode in my Foundations of Psychological Assessment series, and today we're starting with a basic but often misunderstood question. What is psychological assessment? Psychological assessment matters because it guides some of the most important decisions we make as clinicians. Assessment informs diagnosis, treatment planning, educational decisions, disability determinations, and sometimes even legal outcomes. One of the biggest misconceptions is that assessment is just about getting scores. In reality, it's about understanding the person behind the data. Psychological assessment is a systematic and integrative clinical process. As a PsyD student, one thing that's emphasized heavily in training is that assessment is not mechanical. It requires professional judgment. We use multiple data sources, integrate them thoughtfully, and interpret them within context. That integration piece is what separates assessment from simply administering tests. This is one of the most important distinctions to understand early in training. Tests are tools, they provide data. Assessment, on the other hand, is the interpretation of that data within a broader clinical picture. Without context such as cultural, developmental, medical, and environmental, test scores don't mean much on their own. A full psychological assessment usually includes several components. That often starts with a clinical interview, followed by standardized measures, behavioral observations, collateral information when available, and record review. No single component tells the full story. It's the convergence, or sometimes divergence, of these data points that becomes clinically meaningful. Assessment is best understood as a process, not an event. It begins with a referral question. What are we trying to understand or answer? From there, we collect data, integrate that information, interpret patterns, and arrive at clinical conclusions that are meant to be useful, ethical, and defensible. There are a few common misconceptions I see early on in training. One is the idea that one test equals a diagnosis. Another is that scores speak for themselves. And a third is that assessment defines someone's identity. In reality, assessment describes functioning in context. It does not define who a person is. In assessment, patterns matter more than single scores. We're always looking at both strengths and limitations, and how those interact with the person's environment. Two individuals can have very similar scores and very different clinical interpretations depending on context. Ethics are central to psychological assessment. We're expected to practice within our competence, select appropriate tools, and obtain informed consent. Assessment carries responsibility, and that responsibility grows as our clinical role develops. So, the key takeaways from this episode are: psychological assessments is integrative, professional judgment is essential, and context is what gives data its meaning. In the next episode, we'll break down a critical distinction that every psychology student needs to understand early on: testing versus assessment, and why that difference really matters. If you found this helpful, please like the video. It really helps the channel grow. If you're a psychology student, trainee, or clinician that wants more structured, clinically grounded content like this, make sure to subscribe and stay tuned for the next episode in this series, where we'll talk about testing versus assessment in more depth.